Thank you very much for the opportunity to be here. This is an incredible gathering and a wonderful day and an incredible packet of materials that has been put together. So we're going to use that in our practice. So we appreciate that. I'm here to talk with you today about the community experience, the community-based practice experience with PrEP. And I think the last lecture highlighted a bunch of really incredible uh, points about patient advocacy and really trying to individualize care and outreach to folks who are ambivalent, as our speaker mentioned, or other folks that remain at high risk and really could use support and love and a real attempt to sort of engage them actively in ongoing PrEP care. So that's a lot of what we do. A lot of what was mentioned in the last talk will resonate a little bit with this talk. So I chose to tell you a little bit today about our practice setting, how we've incorporated PrEP into the work that we do, specifically with youth and young adults and adolescents, and really to, I think, showcase a little bit some of the more progressive, cutting-edge components to our program, as well as some of the things that have really worked well for us. And I encourage questions throughout. So as you know, the CDC put out this table of who is eligible for PrEP. So these are the categories of people, the boxes, as we say, of folks for whom we should consider discussing PrEP. So men who have sex with men, heterosexual men and women, injection drug users. I'm going to focus a little bit for this talk on a group that's not specifically mentioned in that CDC box, but that falls into all of those categories and sort of crosses the different categories in that table, which is youth. And as many of you may know, the group with the rate of HIV that's rising the fastest is adolescents aged 13 to 24, which for any parent in the room is incredibly heartbreaking, and probably so for anybody else. And if you look at this breakdown, you can see that the overwhelming burden of disease in this age group is among Black and African American youth. So at Philadelphia Fight, which is essentially an AIDS service organization in downtown Philadelphia, we have 3 clinical centers. We have a practice that's solely for people living with HIV, 18 and older. That's the LAC Center. Then we have an adult primary care practice for folks who are HIV negative. That's the John Bell Center. And then we have our youth practice. That's YHEP, Youth Health Empowerment Project. All 3 of these sites actually prescribe PrEP to all of the sort of populations that you saw in the previous table that could be at risk. But for many of those sites, clinicians essentially are writing a prescription for every 3 months PrEP and sort of doing all of the baseline labs and the follow-up labs as recommended by the CDC. At our youth agency, YHEP, we've really done a lot. We've tried to do a lot more than that and really develop an entire program around PrEP rather than just having a clinical setting wherein PrEP is prescribed. And that is our I Am Men's Health program. And so that's what I'd like to tell you a little bit about today. And that's where a lot of the sort of really progressive things we've been able to do have come from. So at our I Am Men's Health program, which we call it that for a reason, I Am Men's Health. We try not to call it the HIV prevention program because I don't know how many people that's going to attract, but I Am Men's Health, this is a program where we really focus on particularly young men's wellness. And we also serve a large population of trans women and LGBTQ youth in this age group. And so YHEP is a drop-in center. There are a lot of services there that are offered to our patients in addition to PrEP. So the clinic actually came much later. And the drop-in center has a lot of sort of educational classes, peer involvement opportunities, bathrooms, meals, hot meals, case management, that kind of stuff. That's really a trauma therapist, the stuff that's really important to sort of wrap around youth who are potentially at risk for HIV. And here at YHEP, we offer PrEP much more, I want to say aggressively than sort of the every 3 month prescription that is sort of asked of us by the CDC. And this is really, I think, important when we're talking about youth. So we've always said PrEP is much more than a prescription, and I think that's no more true, or that's true, very much in a young population. That really, if you're writing them prescription and asking them to come back every 3 months, you are not doing them a service if they're in this age group. And certainly a lot of what I'm talking about can extend beyond this age group to other folks as well. But we offer PrEP at our practice. Folks come to pick up PrEP either weekly, every other week, every month. There's a few people that come every 3 months as the more typical patient, but that is more rare for us. And that's something that our patients really enjoy and appreciate about YHAP, the ability to essentially come in every week and really have that support on a very frequent ongoing basis, which allows us to have a lot of contact with our patients, a lot of discussions about risk reduction and harm reduction, and to really support adherence, which if you don't have adherence, you don't have HIV prevention. And so anything you can do to support that is going a long way to reduce those missed opportunities that we heard about in the last lecture. So, we focus on wellness, we focus on health, we give folks flu shots, we have a run club, we have a drum club, we have a lot of other things that go into this HIV prevention programming. We have an app, this is YHAP PrEP, and text reminders as well. So a couple of things that are just really important, I think, to talk about up front. One thing that's helped us be successful in this endeavor is that this is a team effort. So oftentimes as the phlebotomist is drawing someone's blood, they're talking about PrEP. Our front desk staff, when someone checks in and, they know that their partner is with them and the patient's positive, we talk about PrEP. So the front desk folks often send us a lot of our patients, who are interested in PrEP. Our social workers are HIV testers, and that's a critical piece of what we do. So at Philadelphia Fight, we have a big testing agenda. We have a lot of community outreach and HIV testers, and we've been doing a lot of training and education around every time an HIV test is negative, a PrEP referral should follow. And that's really important. So an HIV positive test means linkage, an HIV negative test means linkage to a different program. And that's something that, has really been important to us. And the reason that we want all these different people involved is that the clinicians are going to see folks only a minority of the time. And it's really everybody else in the practice, and not just the clinical practice, but the center in general, who is going to know these folks and know when they're struggling and know potentially where there may be a need more than we as clinicians know. And so it's important for everybody to be on board with the importance of PrEP. It is likely that people who want to initiate PrEP will be positive, again, as we heard in the last lecture. So at YHAP, although this is changing, thank goodness, about 10%, 1 in 10 of patients who come to us wishing to initiate PrEP is already HIV positive on baseline testing, and they were not aware of that diagnosis. So we serve an incredibly high-risk population, but I think that number has actually been coming down, which has been, I think, attributable to PrEP. And you will have patients who will acquire HIV on PrEP, and this is not a failure of the system, or of the drug, I should say, but I think it's always saddens you. We've had one person in our 3 years who became HIV positive while in our PrEP program. He, much like the patient that was discussed in the last lecture, had been off PrEP for a long time, but despite multiple attempts to get him back on PrEP, he was very ambivalent about restarting PrEP, and ended up coming back to us and saying, "I'm ready, let's go." And when we tested him, he was positive. And so that will happen. And I think one of the most important parts about establishing a PrEP program is having a very good linkage system right up front, such that if somebody tests positive, either on baseline screening or while they're on PrEP, that you can get them in that day, ideally, or the next day, to a place where they can access treatment for HIV. The other thing about PrEP, and again, it's not all bad if you catch somebody who's positive. Obviously, that's not the goal of an HIV prevention program, but you've caught them likely much earlier than you would have caught them had they not been trying to come in and be engaged and either start PrEP or continue PrEP. And if you start treatment on those folks within those first few weeks or months of a seroconversion, that can go a long way towards preserving their immune system, as we know from the French cohort. That often sometimes these folks can stop treatment down the line and actually remain suppressed as far as their viral load because of changes in their immune system that we can block early with very, very early initiation of treatment. So certainly catching somebody early and getting them on treatment early is another benefit of a PrEP program, even though that's not the ideal and the goal. So this is basically our initiation process at PrEP, at our program. And essentially, and this is where I want to start pointing out some of the kind of cool things that we've been able to incorporate. So essentially, first, someone is referred to us by drop-in staff at our drop-in center, YHEP, or again, it could be anybody that refers these folks. They usually get a same-day walk-in medical appointment, and they get a rapid HIV test. If the HIV test is negative, we screen them to see if they would be a candidate for PEP, post-exposure prophylaxis, so high-risk sexual encounter or other HIV potential exposure in the last 72 hours. And certainly if they're eligible for PEP, we PEP them. If they're not eligible for PEP and they don't really have any symptoms concerning for acute seroconversion, viral symptoms, fevers, rash, lymphadenopathy, et cetera, we draw all of their baseline labs, which, essentially is an HIV test, which we use the 4th generation antibody antigen test. We draw comprehensive metabolic panel for kidney function. We do triple orifice screening for STDs, so pharyngeal, rectal, and urethral, gonorrhea, chlamydia, trichomonas in anybody who's been sexually active with a cisgendered woman, hepatitis C, A, B, and C. Screening and an RPR. So that's sort of our baseline set of labs. And then, so now that we have those labs cooking, once they're sort of pulled from somebody's arm, then we have a conversation, which is kind of neat about, should we start today? Or do you want to, is there no sort of rush or urgency in your life? And do you want to come back in a week when everything's back, 5 days, 7 days, go over everything and initiate treatment? But we do have the option for same day start, which has really helped us in our situations where somebody says, that's great, I'm really excited, I'll see you next week. I am a little worried though, because tonight I'm going to a party, and to be honest with you, we're not going to use condoms, and hopefully I'll keep my fingers crossed and I'll see you next week and we'll get going on PrEP. And our clinicians kind of had a heart attack every time that conversation was had. And so we ended up pretty quickly going to the same day start option, whereby once the rapid test is negative and the baseline labs have been drawn, we give that patient 5 to 7 days of PrEP and bring them back in a week to go over everything and give them their sort of ongoing prescription if everything looks good. And the reason that we feel comfortable doing that is that the potential upsides are many. We're trying to minimize those missed opportunities to do good, especially in a high-risk population. And the downsides are really few. So even if somebody is literally bordering on, renal failure, 5 days of Truvada is not going to do anything. And even if that person is HIV positive, despite a negative rapid test, again, 5 days of Truvada isn't going to do anything in terms of increasing your risk for developing resistant virus in that setting. Usually it takes at least 3 weeks, of less than 3 drug therapy to lead to that resistance that we worry about. So other considerations at this very first visit is insurance status. And I think you're going to hear a little bit more about the logistics of that. But again, PrEP is available to anybody. I will just sort of summarize it, with that. And there's a wonderful little flow chart in your packet sort of about the options of if someone's insured versus uninsured, how can they get meds? But it's never a question of, can we get you meds? It's always a question of, how will we get you meds?